Hey everyone, this is Kitty Clinical here with another video, and today I wanted to talk about a very important issue for Step 3 CCS takers. Now, when you're studying for the Step 3 CCS, you're preparing for CCS cases, it's important to know that you are managing patients based on their chief complaint. When they're coming up to you, they're not going, "Hey doc, I've got pneumonia or aspiration pneumonia," or "Hey doc, I've got a femoral neck fracture," or "Hey doc, I've got CHF exacerbation, please treat me." They're gonna come up to you and they're gonna be like, "Hey doc, I'm short of breath," or "I've got some chest pain here and there," or "I've got this and that." So they're not gonna tell you what the diagnosis is. They might try to help you, but if they have no idea what's going on, then that's the reason why they came to you, right? Because they want to know what's going on. So being able to manage patients based on chief complaint is such an important concept and is such an important detail, because we as physicians have seen a lot of this where we manage symptoms and we don't know, we might not even know what the diagnosis is. Maybe it's not even that important what the diagnosis is. If we're treating the symptoms and the symptoms go away, yeah, it'd be good to know what the diagnosis is. But as you'll see in a lot of disease processes, right? Like, I'll give you a perfect example, like steroids. You use that for asthma, you use it for COPD too, right? You give albuterol, you give inhaled corticosteroids, they get better. Was it asthma? Was it COPD? Who knows? It was probably a combination of the two, right? But so when you put in the diagnosis, so actually the ICD has a diagnosis for asthma and COPD at the same time. I usually like to use that diagnosis, but if you don't know exactly which one it is, but you're treating it the same way, you're giving albuterol, you're giving the inhaled corticosteroids, maybe you're even giving IV solumedrol. It is what it is, right? You are treating the patient. There are times where you don't even know what the diagnosis is, but you're treating the patient and they're getting better, and that's that. And that might be the harsh reality. It might scare you to not know what the diagnosis is, but what you can do is certainly make your best judgment on picking the correct ICD code, the one that is most appropriate for that case, and calling it that. So learn to manage cases based on chief complaint, okay? You'll figure out the diagnosis, you'll know all of that based on the history, based on the labs that you order, based on the physical exam. But it's important to know that you're treating the patient, you're not treating if you're on CCS cases, think about treating the patient is what I'm trying to say, right? You're trying to be the best doctor, not the you're not just trying to be a test taker, right? It is a test, and we're all trying to study and do well on these tests. But at the end of the day, what are you really doing? You're being a doctor. And this is important too, because I've tutored lots of medical students and residents who have struggled on Step 3 CCS, and they order all these tests, beautiful workup, diagnosis, and this and that, and then they forget to order the pain meds. Or they forget to order Zofran, and the patient's chief complaint was nausea, right? So don't forget the obvious. Obvious things are obvious. Common things are common. You might know what the diagnosis is, and you might be like, "Oh yeah, this is a fracture. Let's consult orthopedics. Let's do this and that and the other." But then you forget to order pain meds. That's what the patient is here for. They're in a lot of pain. Treat the pain, right? So I hope this is a video that you find useful. I hope you enjoyed this video and that this sheds some light on some important tips for doing well on Step 3 CCS, as well as doing well on your boards and on your practice as a whole. Please like, share, comment, subscribe, and I will make more content like this if that's what you all want to see. So hope you enjoyed this video. I will see you in the next video. Take care.